The number of confirmed coronavirus infections around the world has surpassed 30 million. The worst hit nations are the United States, India and Brazil. But there is a renewed spike of infections across Europe. And as Ryan Thompson reports, Europe is responding with new restrictions, new lockdowns and renewed resolve.
UK authorities are bracing for more cases of COVID-19 in the colder months by tightening restrictions and setting aside extra funding for the National Health Service. New measures have been imposed in northeastern England, including a ban on socializing even inside households. The World Health Organization has warned that Europe should not relax its safety measures amid a surge.
In the spring and early summer, we were able to see the impact of strict lockdown measures. Our efforts, our sacrifices paid off. In June, cases hit an all-time low. The September case numbers, however, should serve as a wake-up call for all of us. Although these numbers reflect more comprehensive testing, it also shows alarming rates of transmission across the region.
This message is setting off alarm bells in France, which decided this time last week to shorten the quarantine period from 15 to 7 days. Although the high circulation of the virus is forcing the government to impose new measures in cities like Lyon and Nice.
In areas where strong measures have already been taken, particularly Marseille and Guadeloupe, if the health situation does not improve and the number of people entering intensive care units continues to grow, even stronger measures may be required.
And in Madrid, the virus is far from under control. Local authorities have requested help from the national government and will announce new lockdowns in the south of the region. Ryan Thompson, Euronews.
Well, let's find out a little bit more about the localised lockdowns in place in the United Kingdom. We can go to London to speak to our reporter, Victoria Smith. Morning to you, Victoria. So already in England, there are rules which means you can't meet up in a group, either indoors or outdoors, of more than 6 people. But now in the northeast of England, there are further restrictions, even localised lockdowns, we could describe them. What are those rules and why have the government put them into place?
Good morning, Rosie. Yes, indeed. From midnight, a huge swathe of the northeast of England is now undergoing further restrictions, further lockdowns. People have been told they can no longer mix with anyone outside their family or social bubble. Hospitality has been told to shut down by 10 p.m. And I can tell you in the northeast, that's a bit of a blow to the pub goers, the restaurant goers and that trade as well. So essentially a curfew there. And we're hearing this morning that Lancashire could be next. The whole of Lancashire except Blackpool could face similar restrictions. And there's a nationwide picture emerging too, Rosie, with talks from the government of what they call a circuit break, which could see the closure of hospitality businesses for a short period of time in a bid to get this second wave of infection under control. Obviously, the government is very keen to see that there's no national lockdown. They know that this would be disastrous for the economy. Rishi Sunak has said that already this morning. But we're seeing an increasingly large patchwork of local lockdowns with more restrictions coming. We don't yet know if this rule of 6, the last set of restrictions saying we couldn't mix with more than 6 people, we don't know if that's working yet. If not, we're looking at more deaths. Medical experts are saying by the end of October, and this circuit break of hospitality shutting down across England until things get better.
All the decisions that the government are basing this on are things like how many people every day get a confirmed case of coronavirus. But one of the real challenges right now is just getting your hands on a test. What is the status of testing across the UK right now?
Well, the government, in fact, the head of the department, the NHS Test and Trace Department, Lady Harding, has expressed surprise that demand is outstripping supply. But it is the cough and cold season. 500,000 of us every day are presenting with COVID-like symptoms. You've got to remember that a cold is a type of coronavirus. Schools have gone back, universities have gone back. So the public perhaps shouldn't be blamed, as they are being, for seeking tests to make sure that their family is safe in this season of sniffles. But the government is telling people people to desist from doing that because there aren't enough tests and people are having to go much further to find them. There are stories of people turning up at testing centres with no staff to help them. We know that even the leader of the opposition, Sir Keir Starmer, has had to self-isolate for longer than expected after one of his children had COVID-like symptoms and he didn't get the test back when he thought. Ideally, you're meant to get test results back in 24 hours, but in the last 7 days, only 14% of test results have come back in that time frame as compared to 33% the week before. Meanwhile, cases here are rising exponentially and it is feared that there may be more deaths as a result of that by the end of October. Nonetheless, Boris Johnson and Lady Harding say they're still confident they'll reach this projected target of 500,000 people being tested across the UK by the end of October.